Maya أحسن من إلهي سلام بقى من بعيد ما تمسك دنزل ولا تعبي زل ولا تعتم زل ولا تقدم زل خليك زل وطني لو أيان ما تسمي الناس تاني نو بسلو يدينك بساهم كل زمان نشان ما تسمي بسلو يدينك بساهم كل زمان نشان ما تكون نيان بسلو يدينك بساهم كل زمان نشان ما تسمي بسلو يدينك بساهم كل زمان نشان ما تكون نيان بسلو يدينك بساهم يا ربنا يا ربنا وو يا ربنا يا ربنا يا ربنا وو يا ربنا ربنا نقدر لكل شيء باركنا جاب جنوب السودان جنوب السودان ما فوق ناس كتار ماتوا زمان حرب فضل ناس بسيطين وغمنا من الشيطان ومشاكل الدنيا أي مرض أي سبب عرفنا باسم الله فيا 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 ربنا يبارك جنوب السودان ربنا يبارك الدنيا يا جماعة لو إنك مهاجرين وجد حلق وجد قلق أساسا في العيون شيلك لمن نشوف دكتور خليك زول وطني لو أيان ما تسمي الناس تاني نو بسلو يدينك بساهم كل زمان نشان ما تسمي بسلو يدينك بساهم كل زمان نشان ما تكون نيان بسلو يدينك بساهم جنوبي لو جنوب السودان جنوبي لو جنوب السودان في كبرجة كبرجة في كبرجة كانوا في مرض طلع جديد كورونا فيروس في نص الناس بسمم ناس بقتل الناس بسمم ناس الحماية أحسن من علاج سلام بقى من بعيد ما تمسك دنزل ولا تعبي زل ولا تعبن زل ولا تقدم زل خليك زل وطني لو أيان ما تسمي الناس تاني نو بسلو يدينك بساهم كل زمان نشان ما تسمي بسلو يدينك بساهم كل زمان نشان ما تكون نيان بسلو يدينك بساهم كل زمان نشان ما تسمي بسلو يدينك بساهم كل زمان نشان ما تكون نيان بسلو يدينك بساهم
All right, ladies and gentlemen, please help me see the video before I bring on our guests of the night. So let's share the video a little bit so that we can have a number of audience to share the video. All right. So give me some minutes, some couple of minutes more before we go on air with the special guests of the show tonight.
Coronavirus God bless the world. الحماية أحسن من علاج سلام بقى من بعيد ما تمسك دنزل ولا تعبي زل ولا تعتم زل ولا تقدم زل خليك زل وطني لو أيان ما تسمي الناس تاني نو بسلو يدينك بساهم كل زمان نشان ما تسمي بسلو يدينك بساهم كل زمان نشان ما تكون نيان بسلو يدينك بساهم كل زمان نشان ما تسمي بسلو يدينك بساهم كل زمان نشان ما تكون نيان بسلو يدينك بساهم يا ربنا يا ربنا وو يا ربنا يا ربنا يا ربنا وو يا ربنا ربنا نقدر لكل شيء باركنا جاب جنوب السودان جنوب السودان ما فوق ناس كتار ماتوا زمان حرب فضل ناس بسيطين وغزنا من الشيطان ومشاكل الدنيا أي مرض أي سبب عرفنا باسم الله فيا فيا مساكين وجد حمل وجد قلب أساسات العيون شيلك لمن نشوف دكتور خليك زول وطني لو عيان ما بسمي الناس تانينو بسلو يدينك بساقون كل زمن عشان ما تتسمم بسلو يدينك بساقون كل زمن عشان ما تكون نيان بسلو يدينك بساقون جنوبي لو جنوب السودان جنوبي لو جنوب السودان في كبرجة كبرجة في كبرجة قالوا في مرض طلع جديد كورونا فيروس في ناس بصمم ناس برضو ناس بصمم ناس الحماية أحسن من علاج السلام تقع من بعيد ما تمسك دم زول ولا تعبان زول ولا تعبان زول ولا تقعد زول خليك زول وطني لو عيان ما تسمي الناس تاني لو مسؤول يدينا بساقون كل زمان عشان ما تتسمم.
All right, ladies and gentlemen, good morning, good evening. Wherever you may be around the world, this is Billy Luke. I will be hosting the program of today with Dr. Sarah Akuot. No, sorry to say that. So, Dr. Akuot and Dr. Malual will be here with me tonight to address us South Sudanese on the issue of the Delta variant, which is a new virus, which is very contagious and infectious. And so we want to take this opportunity tonight so that these two medical doctors can come and brief us about the new virus and what we should do about it. But before we get into this particular topic of the night, I would like to give you the recognition, Dr. Akuot and Dr. Malual, for the previous invitation that you have accepted, and you came on this platform and you came to address us as South Sudanese, and you were able to persuade us as South Sudanese over the conspiracy theory that have been one of the factors that led to the hesitancy of the South Sudanese not to take the COVID-19 for the last few months. Now, the virus is actually coming back, and this is a very contagious, infectious virus of which I want to take this opportunity tonight so that you can actually brief South Sudanese and present to them, based on your expertise as a medical doctor, about what should be done about this new virus and what you can actually advise our South Sudanese in diaspora and back home about what they should do pertaining to this new virus known as Delta variant. So welcome, Dr. Malual, and welcome, Dr. Akuot, and thank you for attending this platform tonight, and thank you for accepting the invitation for the second time. So we will be very brief and short, and I won't be prolonging the program for your convenience. So thank you for being here tonight.
Thank you very much, Mr. Billy Luke, and our esteemed viewers in different parts of the world. It is our pleasure to come and join you and to discuss what we know about the Delta variant. I would like to thank you for inviting us and for your viewers for listening and taking a brave step of going to take the vaccine. It is important that we get vaccinated. Dr. Malual is vaccinated. I am vaccinated as part of the requirement in the healthcare sector that we all get vaccinated. And even if you are at home, I will also ask you if you would, for your own safety, for the safety of the people you live with, and for the safety of your loved ones who are either sick or who are at high risk of developing the disease, it would be good if you get the vaccination. Talk with people, ask people what are the problems, they are having, for example, so that they can understand why they need to take the vaccine. The vaccine is something good. We have been vaccinated from childhood, and that is why a lot of diseases have been eradicated. Yes, people are hesitant because there are still a lot of studies being done. But today we'll focus mainly on the Delta variant. It is just like in Dinka, we say, Achir Labngan, Erawar, variant, Achirawar, yen variant war COVID-19, manena yasas, Achirawar kule ben, ichin the bay. For wake wakakwa, which you can more, which you can lower. Yen and variant, it's very contagious, as you have mentioned. It causes people to become very ill in a very short period. And that is why we are here to let you know who are the people who get it, what are the factors that lead to people getting the disease. It has been seen mainly in people who are not vaccinated, especially the youth. The youth, they have not been taking the vaccination due to the conspiracy theories, and they are refusing, and they think they are young and healthy. But nowadays, I can assure you, and I can tell you that the young people who are sick, and before they get put into the ventilator, they are asking the doctors, can you please vaccinate me? And at that point, the doctors are telling them, we are sorry. We cannot do anything about it. Why has the virus spiked nowadays? Not only the Delta virus, but even the COVID-19 virus. People have become lax. Example, my state. My governor decided to remove face masks. The face mask usually protect you from all the diseases, but our governor decided we don't want it. Why should you force it? But it's for the safety of the people. That's one of the factors. The second factor is that the youth, they are overcrowding in so many places and they have this I don't care mentality. Third thing is that we have developed fatigue. 1 year and let's say almost a half is a long time to try to use all the precautions, the health, public health measures that were put in place. I can tell you, I have made a mistake of being lax. Today, I am under quarantine because I got exposed. I have become lax. I don't want you to do that. I don't want anybody to do that. I've learned my lesson and I know I would be very careful. Was I wearing my mask? Yes, I was wearing my N95. But I do not want you to stop wearing your mask. I was in a wedding shower a few days ago and we were distributing the mask to people. I was at the door and giving people the mask. And people started wearing it. And as soon as they sat down and as soon as they started dancing, they took it off. Now, what happens to the virus during the time people are jumping up, especially our Dinka dance? People dance in a way that makes you breathe very hard. So everything gets exposed. And I remember a young man said, when we walked in, we were given masks, we were wearing it. And when we became so excited and happy, we stopped wearing the mask. So now we are going to ask God to protect us. No, you are going to wear your mask and you are going to ask God to protect you as well. Don't just decide that you do not need to wear your mask. It's important for you to wear your mask. The mask will protect you, even if you are vaccinated. And it's very important that we wear it at all times. I would let Dr. Malual enlighten us more about the COVID variant. He will have more insight regarding the statistics in the US and how bad is it about children even nowadays. Please, Dr. Malual.
Yes, good evening and good morning to our viewers all over the world. And thank you, Brother Jimmy Luke, for hosting us and receiving us for the second time. I really enjoyed the first time actually coming to the place. And today, actually, you invited us back. And also we ourselves, myself and Dr. Akuot, we really wanted to enlighten our community about the variant and updating everybody with what's going on. But you are a fast journalist and you came and asked us first, and we said yes, of course, we have to come in, and thank you for your flexibility and your availability right away, despite we just talked about it, this invitation yesterday. And again, I just also at the beginning, I've said that it's been over a year and a half now since the start of this pandemic. and it's still there with us. And the remnants and the impact and the effect of this pandemic, it is still going on. The good thing, like so many things happened since the beginning of the pandemic. People, they discovered so many things, but also we lost so many people, and we have so many other people got infected and had like some impact on their lives. We call it some morbidity. Some people, they got COVID once, twice, and even 3 times sometimes, and they feel like, well, we never know. And this COVID is just like being, as the Dr. Akuot said, actually, it's changing its envelope or changing its clothing. It appears in a different way. So far, since the beginning of the pandemic, actually, like in let's say December of 2019, and then when it started in the United States, actually, like being like in the impact or core of the pandemic. I think so many variants actually like happened. It means that the COVID-19, the virus itself, it adjusts and change itself. We had the alpha variant, which is B117, beta variant, gamma variant, which is P1, and then we have a delta variant, which is B1617.2. And first time that it was discovered actually here in the United States was in March 2020, and it started to appear and spread in the United States since that time. But the core and the impact, the most, like infected place before that appeared with this variant was India, and this was in December 2020 of last year, or 6-7 months ago, as we saw how many number of people actually died in India, especially when they started like the holy seasons over there. People, they go and like had to swim, bathe, and do their own rituals in the Ganges River, and it spread really bad, and to the extent that people started to bury or burn actually their the corpses or the human remains, because this is the cultural things. And then some people also, like, to the extent that people, they ran out of wood. Even like it was difficult to burn people at a time, so they started to bury people in the shallow graves and stuff like that. And then from there, it spread it in different places, whether it came to the United States, as we said, in March, but it went to different countries and different places. Like we know, like a country that's close to us, like in South Sudan, is Uganda. And Uganda has been impacted badly recently, especially. But before that, like 3-4 months ago, actually, like in April or May, or even like in March by itself, it was in South Sudan, and it really affected so many a lot of people, actually, like especially the young people, and also those who they have like so many like other coexisting conditions like diabetes, hypertension, and stuff like that. And the worst thing about it is that this variant, it spreads very quickly. It spread like smallpox or chicken pox. زي اللي بيقولوا بعربي بيقولوا برجم. If you had burjum, like you feel like a skin rash and everything, but before you get this burjum, for example, if it happens in school, in the class, the whole class will have it. If it comes to the house, the whole house will have it. Especially the beginning of that infection, it will start like fever, like, and then skin rash and stuff like that. I just want to say that because this variant will spread in the same manner. It spread very fast, and especially when people, they live in small proximities, and the CDC recommendation, it became a little bit lax, but the recommendation is clear, and I can repeat what CDC recommending. Actually, people, if you are like all of you guys, if you really know that you are vaccinated, for example, at my workplace, if you are vaccinated, you have a sticker, you can put it in your ID saying that you are you got the vaccine. So people will know, and they are not going to give you vaccine unless they are sure that you took the vaccine, of course. And then if like you have it, sometimes if you are in the office and you took the mask off, definitely, despite it is a very serious place, and we always recommend that people wear mask all the time, but at least like if sitting far away from another colleague of yours and there is no any exposure, you could just like relax the mask. But anytime you are indoors, we need you to wear mask when there is other people actually involved, especially people that you don't know them and you don't know their vaccination status. The problem of what's going on right now in the United States is that they are a mixture of people, all right, mixture of people who are vaccinated and mixture of people that are not vaccinated. And imagine all this mixture. We go to Walmart and we just want to do shopping, but you never know who's standing beside you. You never know who's coughing. You never know when somebody coughed, touch whatever surfaces that is there. So if you relax, this pandemic and this variant is called Delta variant will affect anybody, whether you are vaccinated or you are not vaccinated. When they check the virus concentration inside the body, it is equally the same for those vaccinated compared to those who are not vaccinated when they are not if they are not wearing mask. But the problem that is going to be good, showing the impact of vaccine, the vaccine will prevent it from causing severe disease in a vaccinated people. But if you are not vaccinated, I just want to say, may God be with you. I don't know what's going to happen to you, but this is just like, yeah, God be with you. You just like, I don't know, you have to isolate yourself. You have to, if you become seriously sick and everything, the same things that we said before about coronavirus, you have to seek medical advice. You have to go to your primary care. They may screen you. And so many, and right now, actually, like when the pandemic started, those who they used to come to the emergency room and the hospitals, they are elderly and they are like people like very sick and they having like coming from like senior living facilities and stuff like that. But most of this population right now, around 80% of them, they got the vaccines already, which is something very good. And we have seen the signs in a real action. We have seen a drop in the number of people that admitted from that age group. Now the ball changed into most of the patients that they come to the hospitals, they are either children or they are either like youth. And especially like as Dr. Akuot said, that they don't care, but in their language they don't give a damn about whether to get vaccinated or not. And indeed they don't give a damn, so they are there and they say, what, it is what it is, let it happen, whatever what it happened. But to make it actually to be wise, this virus will never know, for example, that you are young or you're healthy or something like that. Sometimes it can severely impact you and can severely lead to so many complications and catastrophes. So my advice to you is still going to be the same. Like if you're going to the store and stuff like that, you've seen that so many people, they don't, sorry for that, I need to and sorry for that, okay. So many times that people, they say that, okay, they need to like everybody's not wearing a mask, why should I wear the mask? I said, because you never know what's going to happen. I myself am a vaccinated person, but if I go to the store, I will cover my nose and I will wear mask, definitely. Why? Because this virus, if I have it, as I said, it can affect me. Yes, I may not show symptoms, all right, which is a good thing, it's a plus thing. But I have a 2-year-old daughter at home that's not vaccinated. I have a 7-year-old daughter at home that is not vaccinated. I have a guest in my house right now that she has also young kids. Maybe they are in the process to receive vaccines and they're not vaccinated. So if I bring this virus to them, that's going to be a problem. Yes, I have 13 and 12 years old children that they got the vaccine, which is good. Okay, but again, that's the cutoff, like the 12-year-old. We cannot give vaccine to younger kids till they get approved or till the CDC actually approve the process. So I think I spoke a lot, but I'm going to give a chance to you, Billy Luke, and also Dr. Akuot. And then if you have any questions to answer or to ask, we are ready to provide some answers. But I just want to encourage in my conclusion that please get vaccination. Right now, we have seen that so many employment places that they require you to wear, like to get the vaccine. If you don't want to get the vaccine, you will go into serial of, testing, like weekly. Like let's say the federal government decided that, if you work for the federal government, all right, let's say work for Department of Homeland Security or Immigration or something like that, you need to get the vaccines to work there. If you're not having the vaccine, then definitely what's going to happen is that weekly they have to check your they have to test you for COVID-19. And the only exemption that, like for severely, like religious belief, we know that some people that they have in their faith that they don't want to get it, and it is up to them. This is their choice, but they will give an exemption in that. Or you have severely medical condition that will stop you from having the disease, like you are immunocompromised, let's say, for example, a cancer patient, stuff like that. Despite every person is different, and every person they have to check with their own doctors to see if they are exempted or not. All right, some people, like for example, they say, I'm pregnant, I'm not gonna have a baby, I'm not gonna have a vaccine now till I get my baby out. We respect that, and this is your choice, and it's good. And then when they get the baby out, they say, no, I don't want to get vaccine because I'm breastfeeding, and that's your choice also. We respect that, but you have to be extra careful and when you are like dealing with other people. So these are the examples of people that are maybe exempted. I've heard that in the news now, Walmart, maybe they're going to force their employees to get vaccinated. I know so many hospitals now started to have a mandate that, like if you want to work for us and you want to keep your job, I think you're gonna get the vaccine first. Like I think there is a case there in Presbyterian hospital in Texas, and one of the nurses sued the hospital saying that, like she's a nurse. She doesn't want to get the vaccine because of certain reason, and then she got suspended from work. She went up to Supreme Court, and Supreme Court said that the employer is right. So it's just battle. It's going to be a legal battle for you, and you know what? All the stimulus packages that we received and people received and that came, like whatever, like that stimulus package, now it is ending. So like especially unemployment, people have to go to work and sometimes there is these conditions that is going on there. So the challenge is huge, but let us be wise and let us pray. So millions of people receive the vaccines, like almost 49%, 50% of United States citizens, they receive vaccines. Most of the population of Canada and most of the population of Europe, they receive vaccines. So imagine if this vaccine is harmful, where Europeans and the Americans here will take it? No, we're not going to do it. But this is just an advice for you. Thank you. God bless.
Yeah, thank you very much, Dr. Malual, and thank you very much, Dr. Akuot, for the wonderful briefing. I think this is very interesting, and this is very educative and informative to all South Sudanese who are watching right now. This is a matter of health or death. So the purpose of this show tonight is to come and educate South Sudanese and to try the best you can to persuade them so that they can get out there and get vaccination. This is very important because this virus is contagious, is infectious, and it is up to our health professional, medical doctors like you, Dr. Malual and Dr. Akuot, to come to our local forum like this so that you can come, educate our communities so that you can get them out there and get the vaccine, because vaccine is available everywhere. Only that people are just being hesitant to take it for reason known to them, because each and every liberty is actually being respected. This is the freedom of choice, whether you want to get vaccine or not. But this is a matter of death. This is a matter of choosing death or life. So this is very important. So we are actually using this platform to make sure we try to advise our people, persuade them the best we can, so that we can actually save life. So this program tonight, ladies and gentlemen, is about saving life. So we are concerned about you as South Sudanese, but we all understand the reason why we have been reluctant or hesitant to take vaccine is because of the conspiracy theory of which we talk about it. But given the fact that the vast majority of the population in United States or around the world, particularly in the civilized world, got vaccinated. So there is no reason whatsoever for us, the black race, to fear to take the vaccine due to the alleged conspiracy theory, or which we believe as black people. The reason why we used to fear too much is because science used to target us as the black race for some reason. And that is why people have been hesitant. I myself, I was being hesitant. But following the show that I hosted you for the first time on this platform, I was able to go and see my doctor, and I am fully vaccinated right now. So that was the result of your persuasion, despite the fact that people were still hesitant. You also persuade a lot of South Sudanese. They went out there and got the vaccine as well as a result of your persuasion. So I just want to say thank you very much, Dr. Akuot, and thank you very much, Dr. Malual. And we also do recognize you. A lot of people have been messaging me, trying to say congratulations to you in person, but they say you can extend our gratitude and appreciation to Dr. Akuot and Dr. Malual for the wonderful show they did last time, because you were able to persuade them. So you have actually saved life. And that's why I actually invited you for the second time, so that you can come and educate South Sudanese about the new virus that is now emerging, affecting people, is actually being reported to be very dangerous and deadly, and it is actually affecting the normal life. So we thought we were going to, go back to our routine as usual. Unfortunately, the virus appears to be coming back, and this is very, very unfortunate. So we would like to go a little bit. What is the difference between the new virus and the previous virus? Because I don't know why they keep giving them a different name. And does it have a different symptom, or is it the same symptom?
Yeah. All right. I'm just going to jump in. I know Dr. Akuot wanted to talk, but I just wanted to jump in to say, Jimmy, look, congratulations for actually taking the step further. And you are a true leader, and a true leader in this community, Padang community, and you lead by example, and you give it and you showed yourself. And I believe the impact that you have is not because of us, but the impact from the community and the courage that they got, and they got the vaccine, is because of you, and because you took it. And they said that since you took it and you still can come and talk live, then it's safe. Okay, so you build up the trust like that. So thank you for real. Okay, we appreciate this sincerity and honesty. This is great, wonderful. Yes, this virus, as I said, the issue is that it is it's spreading quickly. It does the same symptoms that all right. And if I ask you, the same symptoms is the same thing. If you have runny nose, sneezing, fatigue, it is the same thing that is going on. You will feel like maybe that's allergy, maybe like that. And to prevent it is also the same thing. COVID vaccine is the best way to prevent. In addition to that, but not vaccine by itself. Vaccine and still wearing mask and stay 6 feet away. Avoid crowds by all means. If you are outside, yes, people may relax a little bit, and you could stay without the mask, but also try to avoid people. We have to wash the hands all the time, and we have to put hand sanitizers. Don't let it, let your hand sanitizer be with you, whether in the car or in your brief purse for the ladies, or briefcase, or whatever. And let us have it all the time. And as I said, it causes the symptoms more severe, though. Sometimes the symptoms will be more severe, and the symptoms will be will lead to the hospitals. And when you are in the hospitals, it is also people they go downhill very quickly. They the condition became very aggravated, and sometimes they need intubations, and we have seen and witnessed, and so people actually dying. And some people who are dying, unfortunately, some of them that are leaders in in the churches, and we've seen them. One of the pastors came and was laughing at this virus and was vaccine, and say we'll never get the vaccine and everything, but they ended up actually dead from COVID. And so many other things. It doesn't mean that I'm a Christian and I'm a believer, and I really wish for us as spiritual leaders to be wise and to actually not preaching something or doing something that can hurt other people, because whatever we say as leaders, whether spiritual or community leaders or social leaders or anything, it impact and will actually create some kind of chaos among those people that are hearing you. There is a radio host that was against the virus, still
and against vaccination till he got like COVID by itself, and he felt really sorry for himself that he misled maybe thousands of viewers or listeners that actually were listening to him day and night, and like and laughing, and like and agree, and some people, they go with the crowd. If you say that, okay, you know what, vaccine is bad and everything, people say yes, yes, that's true, vaccine is bad and everything, and then they will go with the crowd and with the flow and everything, and they put that one, and then secretly some of these leaders, even that they're saying vaccine is bad, they go down there, like, and they get vaccination without telling people. All right, even like in some pharmacies, they say that they will wear their mask, wear their hat, they don't want to be seen that they are the people, and then they will sit like that, for example, in the corner till they call their name, and then they just go and get the vaccine secretly and come back, and then they don't talk about it, or they say
and
yes,
then they keep it confidential. Huh?
yes,
That's
exactly.
very fun.
This is very bad. They are very selfish also, because they have seen, for
Yeah,
example,
very, very selfish.
died. It is very selfish indeed. Yes, Dr. Akuot, you can go ahead. Thank you. Dr. Akuot, sorry, you're muted. You can go ahead.
Yes, thank you, Dr.
Yeah.
Malual. And Billy, look, I really appreciate you inviting us. A community is changed by people who lead and people who believe in the community that change can come. And that change only comes when we all come together and we educate our community. Lack of education is a disease. Lack of knowledge can kill people. And that's why today we are here to discuss the importance of the Delta variant. Delta variant, it's very fast. We have seen it in India, how many people died. People were dying in cars. They did not have oxygen. The ambulances were all full. Cars were lined up. People were dying in parking lots. We have seen people who were being buried in mass graves, people who were being burned, and there was not enough workers to do that because everybody was getting sick. Imagine a country like ours, which is underdeveloped and we do not have enough equipment. If this disease comes, I heard that there is shortage of the vaccine now. Initially, people did not want to take it. When it was there, some were expiring, and I think some will expire by the end of this month. Now, why do we let the vaccine expire in our own country when we have a chance of getting the vaccine? We should go and get vaccinated. My daughter, my oldest daughter, is in college. And with the herd mentality where people just go with the crowd, they had all decided they are not taking it. So she comes home. So I told her, look, I am diabetic and I am hypertensive. I want you to take the vaccine. Otherwise, you cannot come to my house. And she told her, give me one reason. We sat down, we discussed, because the younger brother and the younger sister had gotten the vaccine. She was the only one who had the right to get the vaccine. She did not get it. My 12-year-old, by then, they had not yet approved the vaccine for 12-year-olds. But my daughter said, if they approve it, I will take it. So now she felt left out. Then she decided to go and she got her first shot, and then she got the second shot. So parents, keep talking with your children. They will always tell you, oh, we know it all. They don't know. You are the adults. You have to convince them. You don't want them to bring the disease home. As Dr. Malual has mentioned, this disease is aggressive. The symptoms are very aggressive. In a very short time, a person can go downhill and die. And who are dying? The young people are dying. Who are the people not wearing masks? The young people. Who are the people who do not have hand sanitizers? I drove my daughter's car a few days ago, and I am so used to having the hand sanitizer in my car. I looked for the hand sanitizer when I went shopping. There was no hand sanitizer. And there is no reason for her not to have a hand sanitizer in her car because we have lots and lots of it at home. So they are the ones who are not vaccinated. They are the ones who are not using hand sanitizer. They are the ones going out almost every day because now they are going to college, so they want to spend more time with their friends. Last time I remember, a friend of hers came home. So I asked my daughter, I said, is your friend vaccinated? She said, I don't know. So I went and I asked the girl, I said, are you vaccinated? She said, no. So I said, what are you doing in my house? It sounds harsh, but that is the truth. She can easily bring the disease to us. And she came to sleep in my house. Not only just visit, but to sleep in my house. So please, parents, always ask your kids that their friends should be vaccinated and that everybody that they roam around with, they need to be vaccinated. We in the community, yes, there are so many conspiracy theories, a lot of talk and all that, but now things have changed. Get the vaccine, protect yourself. In the occasions, make sure you don't shake hands. I know even I have been guilty. Somebody will come to you and wants to shake your hand. I have been to occasions where I will wear the mask from the beginning of the occasion until the end. I don't take it out. People look at me as if like I'm scared. When I went to Sudan, they were telling me, are you the people who are scared? Ita kun nas al gadin takhafu min coronavirus? Yes, I have children to raise. I don't want to leave my kids behind without the mother. I don't want to leave my husband without a wife. So I will protect my kids by using hand sanitizers, by using my mask when I go shopping to Walmart. People in Walmart have become very lax. You will find the bottles are empty. It's not like before, where you will find the hand sanitizer there at all times, the wipes there at all times. Now they have become lax. They don't clean it as often as they used to. I was in Walmart a few days ago. I noticed that. I was in Aldi's. The hand sanitizer was almost finished. And I was asking myself, why are we being lax? And because people are being lax and the rules are being put by our governors who do not understand the magnitude of this problem, and they just want to object. And as Dr. Malual had mentioned, even President Trump, former President Trump, went and got the vaccine in January. We heard about it only in March, and he became infected with the coronavirus. He was so stubborn, and a lot of people followed him, and they refused the vaccine, and some of them have ended dead. We don't want that in our community. So please go get your vaccine, use hand sanitizer, practice social distancing when you can. There will be times where it will be difficult to do so. Avoid going to places that will cause a lot of harm to you. I am going to start learning my lesson. I am going to stop going to a lot of places. Karama and all that, yes, we have to pay our respect, but still, we still have to work very hard. Thank you.
Yeah, thank you, Dr. Akuot. And I just wanted to talk to. I've seen some of the comments that are there actually, to Billy Luke and everything. Yeah, like some people actually like that are putting some comments, and I really want you to write a comment that is meaningful or mindful, without and we have to respect this platform. We believe in like freedom of expressions and everything, but I know, like for example, Kwan Malual, who used to be a chairman of South Sudanese community in Maine, somebody who's very respectful. First of all, I want to say that you have children, and you have the most beautiful children, and thank you for taking the vaccine, because you have very nice videos and very good children, and we've seen how good father you are. So even if like you say that it's a hoax, we're glad that you took it. Like you took vaccines and everything. And if you have any doubt in your heart that it's a hoax, you believe, I think you're not gonna get it, because I know you. But it is not a hoax. We have seen and we know that so many people from our community that passed away from it. But I really want to cement that. Thank you for taking the vaccine, but also let us be mindful. Like when we are talking, and then like whoever actually is writing any comments, I just want to say that vaccine is. It is not actually, some people, they say that some vaccines, they have some complications, and develop some complications. I just want to say that anything in the world, there may be a risk taking. Like for example, like if you are flying, you want to go to South Sudan, you have to fly home. All right, and you play for a safe trip. We say that we should safe trip, not because of anything, but we know that accident happens, and we know that people, they react to different things in different ways. Like this is obvious. Like if you are driving a car or riding a bike, there is a risk that you could get injured or get hurt. Like from that injury. So the risk of when you're having something, like in your body, it is there. Even sometimes food will cause you some allergies, and so the reaction is different.
That's why you have to check with your doctor and see, for example, like if you are eligible and entitled to take the vaccines or not. And I believe, like the majority of people with the minimal complication that is happening, like maybe like in 1 of 2 million in some of the vaccines, that are available there. It's proof that it is, despite of that, like the risk of dying from the disease is more compared to having the vaccine by itself. So we need to take the vaccine. Really, look, thank you for hosting us again. I really appreciate your time also.
Thank you very much,
Yes.
Dr. Malual. I would like to add something. Always, you look at just like a mizan in Arabic, when you weigh your risk of the danger, and you see what will you gain from it. The the benefits of getting the vaccine are more than the risk that you are going to face when you get the vaccine. Luckily, so far, I have not heard of a South Sudanese who have complained apart from the pain in the arm. 4 of us, 5 of us in my house, 6 of us have gotten it. The only thing that some of us got was soreness of the arm. And that is why when you take the vaccine, they tell you, they ask you a lot of questions. You answer those questions accordingly. The same allergic reaction that you can get from the other vaccines are the same: collapsing, developing a rash, and all that are there. Pain, redness is there with the vaccine. But then they tell you, when you get vaccinated, stay for like 10 to 15 minutes. If there is any reaction that is going to happen, it will appear there and then, and you can be resuscitated. So when you get the vaccine, answer the questions truthfully. Talk to your doctor. Let your doubts be clarified. Let your questions be answered. Make an informed decision. After you get all the knowledge, get the vaccine. If it's something harmful, my people, all the doctors, all the firefighters, all the police people, these are important people in our community. If this was something that was going to kill, they would not take it. Who is going to treat us if all the doctors are gone? Who is going to keep order in our community if all the policemen are dead? Who is going to take people from their homes, the paramedics, if they all die from the vaccine? So reason, get your conspiracy theories, get your information from outside there, but sit and think. God has given you a mind. God has given you the knowledge. God has given you wisdom. Use that wisdom and decide. Always, I would like to say, COVID is real. It has not ended. It is still killing people. And I want you to keep your loved ones safe. I want you to keep those people who are at risk safe. Wear your mask, wash your hands, use hand sanitizers, keep social distancing, avoid places that are crowded. Know the people that you are going to be with, and always encourage. When Billy Luke tells his cousin, I have taken the vaccine, please go take the vaccine, he will believe Billy Luke. Then when I come here and come and tell you, please go take the vaccine. So do your job. If you have made one person to be vaccinated, you have changed the world. You have saved a life. You have helped the community. You have prevented the spread of the virus. Even if you just go and you educate the people, you tell them, hey, if we are gathering here, let's social distance. Let's wear the mask. Let's use the hand sanitizer. Yes, the stress of staying in one place. I have been indoors today for 24 hours. I have not gone anywhere. I've been only in my room because I was exposed. I'm going to stay here until I find my results tomorrow. And I'm praying that is going to be negative. This was going to be the third time that I have been exposed to somebody who has COVID. who has tested positive for COVID. So please pass the information. If you know something, give it away to others. Let them learn, let them gain from it. Let's protect our community. Thank you, Dr. Malual and Mr. Billy Luke.
Yeah, thank you very much, Dr. Akuot, and thank you very much, Dr. Malual. Before I let you go, I have 3 more questions to share with you. The number 1 question I would like to ask you is the issue of health concern in South Sudan. A lot of people are currently dying in South Sudan. And being a medical doctor who are here in Diaspora with us, maybe you have a communication back home with our health professional or some of the medical doctors that you may know could be working in South Sudan. And maybe you can make some health inquiry about what is actually killing people in South Sudan. I believe there is this prevalent death going on in South Sudan. And we are wondering exactly what exactly is killing people. Is it COVID-19 or is it any other health issue? That is number 1 question. The second question I would like to ask Dr. Malual and Dr. Akuot is the question of whether we, the vaccinated people here in Diaspora or United States in particular, are we resistant to COVID-19? Are we resistant to this new virus, which is called Delta virus? As the vaccinated people, I just want to ask from your expertise, being a medical doctor, or based on your scientific, knowledge that you have acquired. Maybe you learned something from the CD. We would like to know, as people who have no idea about the sign, whether we are actually resistant to the COVID-19 or not. And so far, we also want to know the statistic of the mortality rate pertaining to the deaths of those who might have been vaccinated, but they die as a result of getting infection from other people who are not vaccinated. As you know, a lot of people are still resistant to take vaccine due to the religious belief, maybe political, hesitancy, whatever that is. But for us, as the Black people, as I know so far, we have been hesitant because of the conspiracy theory. But what we have been waiting to see what will be the impact and whether these other races are actually going to get vaccine. So that's what I was actually waiting for. I was being strategic when I decided to take it, because when I see that million of Americans, probably half of the United States population is actually being vaccinated. So I was like, okay, why not? I shouldn't take it. That means there is no risk. So I don't believe that American government can actually kill half of their population. I don't think it can happen. That is why we want to persuade you as South Sudanese who are still hesitant out there, get out and get your vaccine. Because this is a matter of gambling with a life or death, as Dr. Akuot put it. So you have to wait. Take your option wisely. Do you want to take risks by dying? Or do you want to believe in that political ideology or religious belief or conspiracy theory, which is no longer, making any sense to us at this moment? So Dr. Akuot, give us the mortality rate. You might have find out that, in your respective hospital, wherever you work, whether there are some people who are vaccinated and they die from the COVID-19. This is to give us an idea whether this vaccine is actually working or not. And then the other question is about what is exactly killing people in South Sudan. As you know, there are numerous reports from each and every family about people dying every now and then. Yes. But they don't tell us exactly. There is no symptom related to COVID-19. So what is this kind of disease killing people? So thank you very much. You can have the platform.
Yes, I will go on because I don't know. I will stay till when. I have children. One of the kids actually here. She's like daddy's girl, so she want to come actually and see what am I doing. So disrupting. So I apologize.
It's okay. Let them play around. It's okay.
All right. Yeah. So
go ahead.
that's why I will go in. First of all, before we
we move on actually like answering the questions. It is all beautiful questions. I just want to take this platform to congratulate. Actually, there is a new the Secretary for Minister of Health in South Sudan, and her name is Dr. Victoria Anip. I really want to cement and say that really she's a very wonderful colleague of ours. And before that, she was like a state minister of health in Lake State, and also she was appointed to be the director or director for blood bank in Juba, South Sudan. And we know that so many things kills people in South Sudan. One of the things that, for example, like the road traffic accidents, like border, whatever, gun wounds and stuff. This is number one killer, regardless of whether we want it or not. And this is like something that we don't want to
Yes.
about, but it is one of the neglected things that is there. And and from lack of like having education, like having blood, let's say in the bank and everything. And Dr. Victoria, when she started to raise campaign and raise awareness. Like here, for example, like the blood bank is it is like there is a huge coordination between the American Red Cross and blood banks in general. People, they donate to not to the hospital. Nobody goes to the hospital, but everybody goes to drive lines and this American Red Cross, where they can donate their blood, and then from there they will divide it into the different places in the United States. And by the way, right now there is shortage of blood in the United States because there is a high demand. Since the COVID started, people started not to go to the hospitals or even to the drive-through to donate blood, and now there is crisis even in the United States. And I want to encourage our people. I myself am a blood donor. I'm an O positive, and sometimes I donate something we call double O RBCs, pack RBCs. Means that I donate 2 units at the same time. They will put back the plasma and then take the RBCs. But I want to encourage people to do it, and it is really great. And so many people did it in South Sudan. South Sudan, as we know, it's a tropical countries, and I specialize in tropical diseases. So tropical diseases in general being very common in South Sudan. All right. And then also the way we in South Sudan eat our meals and food and stuff like that. So tropical disease in general, we have like so many, we call it tropical neglected disease. Of course, malaria is number one killer. We have Kalazar. We have like people, they think typhoid is there, but it's not as prevalent as people think. But this is what accusation. Everybody will say, I have malaria, typhoid, whatever. But so many other things actually like can kill you in South Sudan. Like tuberculosis is still one of the major killers. And there is like so many like brands of tuberculosis, like MDR tuberculosis, and leave alone so many diseases like HIV, which is very prevalent. We were in a country that been in war for a very long time. So many people, they had HIV or they have underlying even AIDS disease, but they don't know, for example, their status. That's why we are like keeping on educating people that they need to wear condoms, they need to practice ABCs, which is like abstinence, like be faithful to your partners and using condom, let's say. And then also if you have the HIV, let's say for example, we want you to get antiretroviral medications. This is one of the things that is there in South Sudan. So many things going on actually like that in South Sudan. But if you moved here and we talk about the variant that we talk about, I believe right now the epidemic. Hey, sorry, I have to mute myself because she's using the printer and she's taking all the papers out of there. So let me mute myself 1 second and disconnect it.
Dr. Akuot, you can take over.
Yes,
and answer those questions.
To answer the question of health issues, I was with Honorable Anip the other day in a meeting, and as we all know, South Sudan, the healthcare system is not the best, and it is up to us to come and help with the healthcare system. It's the role of everybody who is South Sudanese that can do something to help bring change. If somebody decides to take gloves, if somebody decides to take masks, if somebody decides to take money and people to buy the hand sanitizers, you have prevented some diseases in South Sudan. Mosquito nets, as Dr. Malual had mentioned earlier, There are a lot of health issues. People, first of all, do not go for health checkups the way we go on a yearly basis or every 6 months or every 3 months the way I do it here. People don't go. Two of my in-laws died of heart attack recently. If you ask them when was the last time they went to see a doctor, most likely no. A lot of people don't go for checkups. So they don't know what are the underlying issues they have. We don't have the facilities for people to go. We don't have the money because a lot of people are not paid. And most of the places where people go for treatment, even in the hospital, they might send you to go outside to do the x-ray or even the blood work outside when you have not been paid for 3 to 4 or 6 months. So poverty, lack of proper healthcare system, then the prevalence of the diseases, lack of proper education, because most of the diseases are preventable. If you wash your hands before you eat, you will not get diarrhea. If you use mosquito net, you will prevent malaria. If you drink water that has been boiled, then you will not get typhoid.
Yeah.
So simple things that can be done are not being preached in the community. People are not being told what is it. Dr. Malual, go ahead.
Yeah, that's right. And like ignorance is a real big issue. Like lack of ABCs of hygiene in South Sudan is huge. Like for example, right now in our house, my family house in South Sudan, we have one of the people that they came from Panigian, from Duk area, and she was brought from there from Duk to Juba because she was bitten by a snake. And then when she was bitten by a snake, let's say, for example, there was no antivenom. She went to the healthcare center over there, the primary center. They say that, okay, well, they need to open, for example, because there is a wound, they need to clean it up. The people, they said that they refused. No, they cannot take this one out. And then the foot actually like got gangrenous and got like swollen and everything. And it was difficult. So it took like 2 days and there is no antivenom that's available. First of all, they have to know what type of snake by itself. All right, and then like for them, even like when they started to clean, they said no, they can't do that. Let's cut like from the head, from the face here, so let the blood come out from here, but not from the foot. So this is actually lack of knowledge is extremely dangerous, more than like, oh my goodness, more than the disease itself, more than the snake itself. And this is something that is curable easy, but now the life of this lady is in jeopardy. I don't know what's going to happen, but I have to call and check and see what's going on.
But Dr. Malual, does it help exactly the way people do traditionally?
You just
doesn't mean it is going to take out the poison.
You just subject that person to hepatitis or HIV or like different things actually what is going on. So it is just like unbelievable. It is going to add more fuel to fire. It's not going to do anything better. And this is the issue. Yeah, not everything that they are not treatable. Like there's something like some people who are like fixing, let's say, bones. They are really gifted and they know, for example, how to fix it very well. And to the extent that I don't want to say that they do it even better than hospitals, but sometimes they will remodel and they bring something back in a good way. But they're also like need medical supervision in so many things. Okay, and then right now, if you move to just question number 2, if like this new variant, does it affect people? Yes, it affects people, as I said, but the symptoms literally for those who they receive vaccines, it's almost none. It's almost like it will be there, but not actually like reaching the status that it will affect. The people actually from being hospitalized because of the. Sorry, I have to bring her up. Okay, so you already want to be up here. All right, this is one thing, and then another thing is that right now, even this epidemic that is going on right now, of course, pandemic is something global. When it is all over the world, we call it pandemic. But when it is like in a localized place, we say it's an epidemic. So right now, this infection that's going on with COVID, we call it epidemic of unvaccinated, because it is more common. Like even if like we are all like, let's say we are in Dallas, Texas, the majority of the people that are getting the disease are those who are, unvaccinated. To the extent that now the media started to call it actually like maybe the disease of the epidemic or of unvaccinated people, and it is true that is going on. I don't know how to share it or how to express it, but I'm a member of New York Times, but there is a map actually that is there, or even in John Hopkins, it's showing that people, in the cities of the United States, the majority of cities that they are not vaccinated are the cities that are, like mainly, I don't know, but mainly red. I don't want to, like be a
Texas.
involving
Texas.
involving politics here, but mainly, like a lot of red states, a lot of people that are not vaccinated, southern states especially, they have a very high number of people that are not vaccinated. So this is a huge,
Yeah,
like,
not the power. Not the power.
what is that? Daddy, you're there.
My device was out of power, so I'm back. All right.
Okay.
Sorry for that inconvenience.
Good,
All
thank
right.
you. But this is the one that is there. I don't know. I have to. Maybe I shared one of these map actually here in a private chat. If you can put it in what do you call, in the Facebook group, from the private chat, so that if whoever wanted to look into the map to see where is it more prevalent that they have the disease, you could actually check it from that map that I sent you the link to it in the private chat. Okay. Thank you, Dr. Akuot. Please go ahead.
Mm-hmm. Thank you, Dr. Malual. What Dr. Malual has said is actually true. There are still studies being done to find out what are the percentages and the number of people. But they have noticed that the people who got the vaccine, symptoms are less. Those who are not vaccinated, the symptoms are more, and they are getting, the disease process is very aggressive. They have the symptoms, and in a very short period of time, they start deteriorating. You had asked if people are resistant to the COVID vaccine. Yes, you can get the COVID again for the second time, even if you are vaccinated, depending on your immunity. Our body, it works just like in the military, you have the army. When somebody gets vaccinated, the body starts producing antibodies, and these antibodies are like the army. The more army you have, the more your body will be resistant for you to get it. Yani it's like mantiga askariya nangich jesh. Jesh ku dir ku chak ben chakaj ben buwa ben bukaj ben buwa loy hujum ku to jesh ke wachi nake karet. Lakin na liu jesh ku wen nake. It's the same thing, same theory. If you are vaccinated, your body starts to produce antibodies. These antibodies will prevent you from getting the disease in a more serious form. But if you are not vaccinated, you are prone to getting the disease. And that is why people who are not vaccinated are more sicker than those who are vaccinated. And yes, you can still get it. That's why we keep saying, wear your mask, use your hand sanitizer, but it's a small percentage. Use your hand sanitizer, wash your hands, and keep social distancing. I hope your answers.
I've shared the map actually, like briefly, if you check the map of United States, if you can put it up. I don't know, but I shared it here also in the studio down. Can you put it up? I don't know. Can you share it because you are the
Billy, look, can you copy what Malual has put
no,
there?
it is there in the studio down in wait room.
Okay. Do you want me to open that
Yeah,
link?
you can open it. You can open it and just like let's say, yeah, you can open it. You can bring it up.
Okay.
It is down in my share room, in my waiting room. Just like to give you an example of how this is very prevalent, like this Delta variant. Can you put it up, or you can do it?
No. I have to log into a different.
No, I stopped sharing it, but that's fine.
So there's no way I can bring it to.
Okay, that's fine.
Maybe I will do it another day.
Yeah, that's fine. That's okay. Thank you. Okay. All right. Yeah, but this is actually like the truth that is going on, Billy. Look, and like mortality rate, even the statistics are there and it is there. But I'm sorry, I did not bring and prepare that question specifically to look into the exact number of people actually that are dying. But the number it is really high, and it varies from state to state, as I said. And if you click into that map, you will see for example, like how many people, like let's say they got affected, and also you have the map of people that they received vaccines. Like, for example,
One.
the less impact that they. Yeah, sorry, it was double screen. You are double screen now. I can hear. There's some technical issue. I don't know. Okay, all right. This is okay. This is one of the. Okay, I think this is one of the maps. But let's go here. Like when you go down, yes, exactly. Excellent. All right. So this is like if you click in one of these maps, let's say for example, like here in Texas, you can see that for example, like uh, uh, the people actually that are vulnerable for infection actually with Delta variant, it is actually like it is reflected with the like with the number of population of people that they got the vaccine or not. The less vaccination that you have, let's say here in Texas, the more likely that people they are getting vaccines. And here, like the opposite, like when they more people that they're receiving vaccines, they have the less like percentage of them actually that they can get the variant, that they can get the variant by itself. So it is promising, and this is something that we need to do. And as it says here, like the public health group suggests that more than 40% of U.S. residents may not be sufficient protected against the Delta variant, and this is true. But these are the like statistics that is going on. But for the actual numbers of people that are infected, actually, it is not recommended or documented here. But we need to be very mindful. For example, in different hospitals, they are still reporting it, and you have to follow your state to see, for example, the exact number or statistics. So thank you. All right, for sharing this this map and just showing people where the risks are indeed. Okay, I can stop the share. Right, thank you. All right, thank you. You did great.
Dr. Akuot, would you like to add something? I don't know why there's too much echo here. Let me log out.
Hello, how are you?
Hello.
Yeah, I did.
For you to
I
join
was
us.
busy. I say greeting to everybody.
Greetings.
I'm coming from very busy places now.
Thank you. Thank you for joining us. It's a pleasure to be on your show. I know last time you were with us as well. So thank you for taking the time from your busy schedule to come and join us. We are almost coming to the end of our medical discussion. So as Dr. Malual had mentioned earlier, having the vaccine protects you. Not having the vaccine makes you more prone to getting the vaccine, as he has showed, getting the Delta variant especially. So please be vaccinated. Use hand sanitizers, use your mask, use the safety measures, and educate your community. Thank you, Mr. Billy.
Billy, look, you listening?
I think he's muted.
Billy, look, are you muted, or can you get our point or no? Any?
Yes. I'm coming back.
Okay, you can hear. Huh? Why are you logging twice?
Yes, twice. That's why you have an extra.
Video. Can we log out?
Billy?
Young dear.
I think Billy, look, you need to log out and log in, or log out one of you. Remove one of the because you're logging twice. That's why you have the echo.
The two devices, they are an
The
echo.
two devices.
Okay. So Bill, look, you listen. Bill, look, it's frozen. So the topic is still going on, right? Or do you guys waiting for Bill look before I ask some questions?
I think that we just open it for some few questions, but we're almost coming into conclusion. And I just want to just conclude by saying that, like, we are really so much grateful for hosting us and receiving us, Padang community. It's a great community, and we are really so much happy to come here. We are your people, and we just want to encourage in my last message, please, if you did not receive the vaccine yet, please do so. Vaccine is not going to affect you negatively. In fact, it's really going to help you in to keep you safe, actually. Especially the virus is getting smarter. It's trying to still wanted to come up and affect more people, but the way forward is vaccine. If you are in a close proximity, we advise that you can wear mask, you can still wear your use hand sanitizers, and we still like observe social distancing, 6 feet apart or 2 meters, and we hope for the best. And I know that, for example, like if people are traveling by air or something like that, the airlines, you still need to wear masks. If you want to travel overseas, sometimes they will ask you, for example, the airlines or the country, that you have to get the vaccine. But now things are changing a little bit. Let's say, like, since the beginning of the pandemic, and the Canadian-American border is closed, but it's going to open, let's say, in September 9, and then in September 21, people can move on again. And the rate of people that are vaccinated in Canada is higher now than the people that are in the US. Despite Canada has a small population, but not because of that, because most of the people in the US actually, like, whoever wanted to get the vaccine, they want to get the vaccine. The majority of people now, they are just like sitting down and they are not actually planning to get the vaccine. The school is going to open back, especially young children, they are unvaccinated, and it could be like a time bomb. So we are really afraid and scared about them, but we are advising all the adults, please receive the vaccine to protect the children and your children and our children. Thank you, Billy Luke, once again, and thank you, Brother Daniel, for having us. Dr. Akuot, always pleasure to work with you as always. Thank you, God bless you. This is what I want to say.
Yes. What you can Dr. Akuot, Kujala, Dr. Malual, what you can lead Kawaye Miss Kwan Jing, Kuyake Dicto Kwan Jin Sudan, channel Kanaka channel the Jing, the Pada, Lakin, I am one young Ben and Ben diety, which you know be a diety. So the reason why again, Ogjam Tong Lizzy, which I'm big in Ubin Cocker, big pink. Kadane channel da no lu advocacy issues unte kare lakin agem ku issues ka health issues ka yoga lo bulu address language unte mbira an ban ping wa yen wachu kale in Dr. Akuot ujala Dr. Malual ka we mit kon gi jeng apiat baga wat ci dikane bag bana lek koy kon ko mon jang dai ujala junubin big ping ka unte ka ko pi apiat bika bena le ke kwa yen wecha kele jaret ke chage pursa kene chage nom bag bende time o ku bag junubin baki kon ko wonte ko bingi 2020 nte ke loro pinnam to ya ni ai Dr. Akuot Dr. Malual na de daman chage ting nang to anyun ti loñ ko le junubi apiat baga ben bag ben kwen ko chana go ko de malumat ku ye ngolo bi ke kon you see, appear the kind of bagalo wire. So in Chale, Dr. Akuot, Jala Dr. Malual, Chak, Chodian Chan, which all Chagan Ping. Okay, you Ben one Chak Ben show one to Engel, Jala show can I took out with a womb cake one. This time around, a yoku no virus can came more deadly. we ko ko ndai to ki yo we lim apia bran biran de ble ma taipa ku bi la tom agwo pi because the virus kene e virus de ara jere ka tong ka ngwen virus wan tila toy wa kene en ke chalan doctor Akuot ku jela doctor Malual a chan bi we ben we ka won ge lo rot mi bale ye ni jam na virus kene tak dan we da news kon ga America yen mostly and da news wal ka tot yen loy to ka lo rot ke yen che ke yen ye consent ko ya nya bu bana rom we ko we junubi ko we jing da pin na ban goran biro la ko ngi family de barandu bale ma taipa bele to bela agwo pi to don ko be lui believe ko la non ke de conspiracy ko wano jam tin kene a chil ko ber yo jani mo chan ka waja de ko nga ke joj wal kana wo mo de bana ya kana wo ka ngwen bon no you see so I should be lui believe in a conspiracy tak there maybe Africa an be ro loyti chan non to bi ka le tin wal ke walun be le yen ka wal ko bi ko le lo bi ka population take it tak there wal ko bi role en ke ko wano rio kan but the men chika waja chika to e kapya da yabo to because population di dai to we can I can believe the way junubi na ko ju we e nyu odu no we bulu sabam kwa apia bag bran mula go we go pi bedel bo be lo biga e chi wi o chi wi biga yeah and I lost one of the brother pandemic one will go twin ku ka chu to ba ne so kana chu wi bi da lo one te be lo lost kwa kana aleja ni Dr. Akuot ja Dr. Malual apia daga ben yi daman chagen tin ke nong ko be le ginu bin mi ga ko te ka pa na kim ka pia bakara ning de ko ro di ginu Sudan di man to ko ji a wi bag bana lo charo akere side le loy independently wala ra le ben bag ben charo go go tele we ginu bin dai apia na de ra go de to alon ko ba ti ayi to anyu te yu dalin banong to al ko ba ti di to ke Dr. Akuot to Dr. Malual to and ba ke bana ti to ala to kene ayanta am dun lim Dr. Akuot da Dr. Malual ak ben ayi daman jang nim law ko ben alu all the tene buga jam health issues ayi to anya bi ran jam tin any concern to do with the health you can come and present your question to Dr. Akuot to Dr. Malual so they are here to help us so what you can lay for your volunteerism time when jang num ko jagro duare daman tin ba ben ko so ko ju jami pio tedu in Dr. Akuot Dr. Malual because word one on chat jam ne chike bela wu so we hope this time around she virus can be ben take the a big deal thing so we chakale daman du na lore chokor ran ti ben gene ka yo kan ke Daniel ka my co-host media ye na total loy won ayo ke jaben bai ke le wa yin ballo introduce dun Daniel welcome ka yo jam na chelo Dr. Akuot re dam me tek de pelo lui miak ko ne Dr. Malual kan ke ko front line ajere health professional in the United States so we took a late for your horizon loy we ka fana United States so keep up the good work ko lui na loy binu bin kaman ba ke bana we de kan na ka wa yin we tek late you do log up the by you can swallow it ko bet yi
yeah I can probably I can swallow the biran ke somebody like me in order to come guess kuona ke kubendena them abiwo ke wo gam tong nyili ko jana tong buin can be you know be nen ping benefit you know be ban karane willing can be bendai could be ping how to protect yourself and families this is the good place to come and ask any kind of questions I myself I'm not a doctor but I work in healthcare facilities so the prevention and all using a PPP, personal protection equipment, and so on is not new for me. But I do have a lot of questions. If I see somebody, doctor like Akuot and Malual, he will know more than what we need to protect ourselves, and that is what I'm encouraging anybody, not only people from this media, but it should be all South Sudanese to understand how you can protect yourself and when and how you can get your vaccination, because now is a time for everybody to protect himself. Because coronavirus is it's the same like any many pandemic diseases that happen. For example, polio and so kind of diseases they passed before, but people was try to protect themselves, until now. We get rid of polio, and now we got another thing. It's called coronavirus, but I hope we will get rid of it if we follow the step or procedures, and then we will be okay for there. But I do have to add the question, but now the time it's been a long time. I want to say thank you to Dr. Akuot and Dr. Malual for coming here to let South Sudanese learn how to protect themselves or how and when and how they can get their vaccination. For everybody, vaccination is some people say it's bad, some people say it's good, but as is needed, we need a vaccination to protect other people. So, Dr. Malwal and Dr. Akuot, which already we can benefit on Kiban, Kinanato somewhere, America is the place for busy. But yeah, one thing I wait okay, let me come and say hi to them, and then arrangement and look, and then we will let other people know ahead of time. Maybe not gonna be me and Billy Look. The next time we will be having a lot of people, and we will try the best to make sure we collect somewhere there the level so we can make a very big conversation. Inshallah, book there 9 people in the screen. The next time she will arrange. For Dr. Malwal and Dr. Akwar, thank you very much and
Thank you very much, Daniel, for the wonderful insight. Dr. Akuot, kujala Dr. Malual, then go back your Martin. When took a lake, who quite one more young Amipiot, check up an unkaja king. Can't you just check that away? They just like to watch, but now, what I have been quite a one. Anything to do with the allergy issues, well, a counter, jam, a car gig or deal, like you know, let the account be quite a lot more than a job where with young. Just follow it. Like he can actually get excitement. But I eat a caterpillar, cacachanga. I hear what you can lay, Dr. Akuot, Dr. Malual, now they closing statement back a little. Vaccination is actually ticking up now based on what I watch on the statistical. Why? Because people are getting fear. They don't know this virus is going to be very deadly. I could die in news one America. We're quite one to die. Who take they been convened. And you can't believe in a religion. I don't know. It could be religion. That didn't mean they don't believe in sign. Well, you can really never coin. Other issues of the health concern. Issue with can politicize. We believe in conspiracy. In Dr. Yoga, I check why. Because it something to do with the individual liberty or freedom of choice, whatever that is, according to the constitution, you look at violation of individual freedom or liberty. So that's why here and there, choice that they put attack, but a womb or a womb. But according to that, they get responsible for spreading the virus. But once you got your womb, now want to meet the baby quite to because in you. In Kanamana, ya dog came and came care of that. Lakin the Shira, even woman guy, you not in the virus can be quite up. I just quit to cheat young again, Dr. Akuot, but in Damanduna law. Who jam like a little more alone, like him, Obocoy, Jan Daman go with you.
Ben Daniel, in the late Chawadot, Abija Gur, the Tongwanja, who in Billy Look in the late red. We panda we mitwa we workwa twanye ye delta virus chirman e kom yen ka chirawar chiman yi lagngan ina chi ben to wen nang e ke mango ka wara ko na chi ben to wen nang e ka chirier ka wara yen ka cho ka delta virus yen ka chirawar ku ben chen bala ben anya ke water yi bonjang lwel awala wana ye lwel na la ben ama ke nala ben kan kiralip ke kachigan delta virus ci ben men adakach ret fatamka bakala bo wala tom yen na dom yin ke nafsa wal wari ye coronavirus en ka jam wala tatin atwo ci go we do rier laka panakim run kerer bayi wa ko wechen mana có cha chỉ lo cái phần munasaba là chỉ cái lo cái gió cái mẹ na chỉ có cha yen mask cái chiên ya cái chiên ku ya cái rare bên nghe bị ya rare từ bên cái là cái chỉ mi tiền cái rồi wala cái chỉ 6 feet ya được bị rare cái mẹ ra nè wa ko wachin ya cái chân mask cha man to mask je ten adik bi ran ta we ku bira da kum ta ku ban akwai yang ato kan we ko dukane yeran chitwan yeran nang ko yeran nang delta variant yeran chi be yeran chitom kilitom akwai ko wona be mane delta variant chu yo ai ko wen ken ka tom ko tabka bakalu chatom ke bala kasmit marka mit jam ka ken mit ko ken shabab ha re tuom jam ka ken ke ka shar go ka tom mi da budu su kule ke pana yep ko wenyi yaka meeting yaka yen face mask bike ga kum ko bike ga to kum twanye re ko yaka le ping ki wo ping coronavirus a kai tuk de abben ki ye yin yana wa ka kin ki ye yin yana kumi kumi tok apiat ki ye yin re te me kana randena ku baka ya ting na ce lola tero munasaba lola ka biya ka kiti di ka biya ka kiti di don ka jwa ka biya bot ke ko li ka ku banga biya re te me kana nga yana kan le bu pen wannan ka ke to don wa ka dalas wa ki banda a cikin wai loss na ye junub wet ka walan a cikin yin jiya covid-19 mamada a cikin wai loss in mama chiwi lit yen ga ran ko to tan wo ka Dallas ten wannan ka kir ta da ka kir ka ke tiro ki to from covid-19 wa ci kurbu ku ba diaw wa ko bu ko pir we tam ka wa ka wakin ku yaka rudgel twai nit apya gal ka rat ku ko won twai ci man ko won ci dir bay ko won nan daket ko won nan sukari ran won nan aids wala nang twine de chama saratan ke goda achi lubrom ken kom coronavirus tam ka red bakarat gel nyana cha boya gel ku bakarata gel yada ku yin cha lekin ban beli luk ku yin ban daniel chor chi wo chol bi wo ben video do na ja kola we ko dai we cha ka leka kach yango delta variant ya damada kulo ko bakar gelada sukula bugal gal ka mit kwan wacha kale charet
Again, thank you very much. Bill, look, okay. Bajo loin bill look wala book don ko ba doctor jo la break long.
Dr. Malual abadial ben ku
no yen achi jali yen lanu wera mat well an bijal yen a ping lakini chimba kila taj
Okay.
we chakale ni abatan an banda man yen ye Malual Dr. Malual Mabur in ke banda South Sudanese Health Professional Association in the US we chakale charet janib da waba jajal am bijal ku gal karat yin chale charet we loy piat yen ke ban yiran mo ta kapiat ya ke loy we chakale.
Thank you.
In chugle jaret Dr. Akuot nyala BTA ko pandu ku jala mit ko
nyala
wanda ko jale jin chaga man toga go one day big India yok, so they want to know you personally. So ye na chin ngo nyala BTA loan pia dun te loy junubin chaga man chi ni pay for it in chiro volunteer ba ko bana yeg information ki ye dicto in chugle Dr. Akuot na de daman jabe yok ku nong issue jidit ke ben yal mit bale in delta variant kene kapet bu ke be na charo yen jale time non jano ku yen be so bu jo tem ku yen be purta jo be no yiwen be ne lo jan ki yo ko to And and guy and I'm feeling exhausted already. So in Chile,
Yeah, which I can like. Thank you.
Thank you.
Good night.
Daniel, would you don't
Okay.
come on.
Okay.
Dr. Malual, Yogin Pingitan, and let the Tagnadi Kabaloy to take the booking team command. Why in Wakoy Kwandai, and get chokadi? Data Barian, K Twine, K Bira, did it to Ben, K Kuluminle, coronavirus, and Yamukin, K yin virus, can Chibella Ben in a different form. Kwa can ye more deadly than virus one will can. Kwa can yo with lim ka way chap down jing which chap did you Sudan ban a cobra and ban womb a chana maneke a matter of whether balu gambling live do we can actually we catch all fee a piet to dun to any way I would be in a womb a go around that pay a go protect it can have weird. Why yin kia jing tau ten while ye junubi who yin tom please get out and get vaccine. While at the same time CD when the Center for Disease Control the United States the chief recommend mess up once again. So people are actually being advised to mess up again, and now it is becoming mandatory for some government institutions as well as some of the state and the companies. They are actually urging their respective employees so that they can mass up and take vaccine. And if you don't take vaccine, then you will be required to take regular vaccine testing. So we don't want any of you out there as the South Sudanese to lose your employment opportunity. So for you to retain your employment, you have to comply with the demand of that particular company that you work for. And I think it is going to be mandatory for some of the government institution or bureau out there. So each and every employee will be required to take vaccine as a matter of protecting other people's lives, because there are some people who are hesitant to take vaccine due to those conspiracy or political belief or maybe religious belief. These are the factors that are making people to be hesitant to take the vaccine. So this is a matter of gambling with your life. Either you want to take risks with the death or you want to save life. So the reason why I invited two doctors, senior doctors of Sudan that are now working here in the United States, is to come and share with us their experience being a medical doctors here in the United States. So we take this opportunity to give them an acknowledgement and recognition for the wonderful job they are doing in sharing their knowledge and expertise with us as South Sudanese. So thank you very much, Dr. Malual, and thank you very much, Dr. Akuot, for your volunteerism to come and share with us your professional expertise. So we're looking forward to host you for the third time in case there is going to be a high mortality rate pertaining to this contagious and infectious virus, so-called Delta variant. So I wish you the good luck. Go and get your vaccine so that you can be safe, so that your family or your loved one can be safe. So this is advisable, and please listen to us. Thank you very much. Banyo tek na de kabijo Martin ku buktoda.
Red bill look in Jaleja.
Yeah, na mijola yoban chita kareta yeah and that and to white jamin. But yeah, and kita in a mood.
Okay. Yeah.
Yeah.
Okay. Yin pingana manam.
Yes.
It will take a long, and I know Dr. Akuot, book like Dr. Malual. Which you been a kin quite corn a cake die and book like a work awareness in Louis and book like a Iranaban can be a care about vaccination. It mandatory when bill in between by mandatory. Can your health in a being your Louis decide. Kin you need vaccinations. you got your ben different diseases, viruses. Yeah, coronavirus, like in some of them they coming, awareness, quite Louis learning how, Chan Bakrang Louis. Maybe she be a one-time awareness, Dr. Malual, Dr. Akuot, and Big Ben could be quite let, yellow root, we quite one a week die. Which Barnami can be planning one day, we book it like ahead of time. Kubran the num time be ben lakin maybe be around 45 to 1 hour due to kakaloi pa iran ban chiran the num time lakin can buy information being it don't need a long time, it just even 3 to 5 minutes more information alone
Yeah, the document chi brother dan to wajana ko ba kwendi ke document the ke CDC when the Center for Disease Control with the United States when ke got
for the CDC.
So document gonna we ba kwendi be quite big thing mit bale
about the protection, well, about well, the document is talking about the protection while the new viruses and
no kare virus GMO kare. So
the new
can go here and information briefly. It's supporting the and kilo equipment with all this stuff. He Dr. Malual, Chen Kitui go new other than case statistic. It's stated the key virus affect it. Kake is stated hesitant to take vaccine. In a deed for mortality rate in July infection and loaded at all southern state mostly because southern state majority of them hesitant to take vaccine. I don't know whether because of the political ideology Donald Trump will or is it something to do with religion? Religion and globally conspiracy when in talk against it. Well, can I share it? Because the child, what they in the believe so they don't believe in science or what? I share only. Now, a political man, we don't see the reason why the issue of the COVID-19 has to be politicized. Educating, it's crazy, even the way and where the news generate. So, yeah, document can have briefly book and book you. All right. Ladies and gentlemen, I would like to share with you this document from the CD. CD stands for Center for Disease Control in United States. So what we know about the Delta variant of COVID-19 following new CD report, the Delta variant may be the most severe and contagious form of COVID-19. This report was actually published on the New York Times. New York, an internal document circulated within the Centers for Disease Control and Prevention warned the Delta variant is more contagious, more likely to break through protection afforded by the vaccine, and may be more severe than the other variant of COVID-19. Here is what we know. Number one, Delta variant is highly contagious. Highly contagious, that means it can be transmitted from one person to the other. That's what it means to be highly contagious. That means it's it can actually be transmitted very easily than any other variant. So the CD say that the main difference between the Delta variant and previous strain is that Delta is highly contagious and likely more severe. Plus, breakthrough infection caused by Delta may be as transmissible as an unvaccinated case. That means if you are not vaccinated, ladies and gentlemen, if you are not vaccinated, this Delta variant can be more contagious and can be more infectious, and it can easily overwhelm you and kill you right away. So this is an incredibly incredibly contagious version of a virus. It is almost like a whole different virus. Dr. Ashish Jha said, CDC is estimating that it is probably also more deadly. Number two, symptoms are the same. The symptoms are generally the same as other COVID-19 strain. Fever, the symptoms are fever, cough, shortness of breath, loss of taste or smell, or fatigue, respiratory congestion, like when you have so respiratory congestion, like nausea or vomiting and diarrhea. However, physicians are seeing people getting sick quicker, especially younger people. Vaccinated people who contract the variants are either symptomatic or have a mild symptom. Number three, unvaccinated people are at risk. Unvaccinated people, that means people who are not vaccinated, you are highly, severely likely to be exposed to the Delta variant. And so you are at risk. That is why Dr. Malual and Dr. Akuot came to this platform to come and advise you to strongly recommend you as South Sudanese to take the vaccine so that you cannot be vulnerable or risk to this disease. So nationally, 97% of the patients hospitalized with COVID-19 are unvaccinated as of July 22nd. In this month alone, 97, this is a very high number, isn't it? This is a very high statistic. 97% of people who are now hospitalized. And among these people, you was hospitalized already. But the she came to man, that they can isn't it? So can it in Kakalima way, go away we are trying to save life. When it go on Dr. Akuot, we lie in Dr. Malual, okay, Chol, I can big ban Louis Sharek away, take a expertise in the medical field. Number four, vaccination is the best protection, but breakthrough cases are still possible. The scientists are still skeptical about the possibility of this vaccine in protecting people. They are still actually studying it, whether this vaccine is actually working or whether there will be some changes, because nobody knows yet. So they're still studying the people whether the vaccine is actually working or not. The efficacy of the vaccine is still under study. So vaccination is the best protection. Yet, nevertheless, this vaccination is actually helping. So go out there and take your vaccine, because it will actually protect you. You will not get sick easily. But people who are spreading the COVID-19 are people who are actually not vaccinated. You could be vaccinated, but you could be resistant to catch that virus very easily. That is why it is quite preventable. So vaccine prevent more than 90% of severe diseases. Some of you are already listening to it in the national news. So if you are vaccinated, the vaccine can actually protect you 90% of any severe disease. Any severe disease, it can be any other disease out there, it can help you. If you take this vaccine, it can help you get attacked by other disease that may want to affect you, other than this virus. So it is also very important, and it is highly recommended that you take this vaccine in order to protect you from other disease, but may be less effective at preventing infection or transmission of the Delta variant. The CDC came to find out that this vaccine does not actually prevent the transmission of this Delta variant. So that's why people are actually being advised at this point to mask up again. You need to put your mask back on again, because you could also be a carrier of the virus. So that's why everybody is actually being advised, put your mask back on you again, because you could also be a carrier. And if you are actually contaminated, you could be resistant to it, but you can carry it and it can affect the other person that is not vaccinated. So this is very important. Therefore, there could be more breakthrough infections and more community spread despite people's vaccination status. Despite the fact that most of us are vaccinated, you can still transmit the virus to your loved one, to your friend, and to other people out there in the general public, wherever you meet. Maybe you meet in a community event or other activities. So current vaccine continue to provide strong protection against severe illness and death, but the Delta variant is likely responsible for increased numbers of breakthrough infection. Breakthrough that could be as infectious as unvaccinated case. Dr. John and Brownstein, an ABC News contributor, say, this internal document highlights the challenge we all now face in combating the most transmissible variant of COVID so far. Number 5, vaccinated people can spread the variant. The CDC new evidence that vaccinated people with breakthrough infection could carry enough virus in their noses and throat to infect others. COVID-19 vaccine greatly reduced the chance of severe illness and death and remain effective against variant, including the Delta variant, but it is still possible to get infected. So masking could prevent the spread of the virus to children too young for vaccination and people with weak immune system. So people with a weak immune system are people who are old, or maybe it could be people suffering from respiratory disease, such as people who have a lung problem, maybe people who have heart disease, people who have high blood pressure, people who are suffering from diabetes, people who have a kidney problem. So these are the people with a weak immune system, because your immune system is already weakened. Also, people who could also be vulnerable could be young children who are not eligible. That means they do not qualify to take this vaccine. But according to the news or according to the CD recommendation, only people, I think children with the age of 12 and above can actually take COVID-19 vaccine. I think I'm correct, right? So, ladies and gentlemen, this is very important for you to take this vaccine, because it helps a lot. But it still is possible to get infected. So masking could prevent the spread of the virus to children too young for vaccination and people with a weak immune system. Number 6, Akuot recommend wearing a mask even if vaccinated. You know, wearing mask is actually being recommended. Even if you are actually vaccinated, you still need to wear mask right now. This is what is being recommended by the CD. So the CD on Tuesday, citing new sign on the transmissibility of the Delta variant, changed mask guideline to now recommend everyone in areas with substantial or high level of transmission, vaccinated or not, wear a face covering in public, indoor setting. A mask protect others in case you are carrying the virus without knowing it. Because you could be a carrier of the virus and you may not know. So that's why it is actually very important for you, ladies and gentlemen, even if you are vaccinated, you still need to wear a mask so that you can actually protect those people who are not vaccinated. You can actually protect your young children in the family. You could actually protect other people with a weak immune system. So this is very important. This is something recommended by the CD. These are the scientists that actually control the disease and give new update or guideline about the new disease or anything that is actually scientifically evolving pertaining to the disease. Number 7, more COVID-19 variants are likely. So there may be more variants that are going to come, according to the scientists. So four notable variants already exist in the United States. This is about the history, about the past. So previously, or in the past, there used to be some virus that were here in the United States previously. So these are some of the virus. There is this virus known as B.1117 alpha, they call it alpha virus. This variant was first detected in the United States in December 2020. It was initially detected in the United Kingdom. Initially, it was detected in United Kingdom. So they call it alpha. You know, I don't understand why they give it all this scientific name. And then there's the other one, they call it B135351. They call it beta. So this variant was first detected in the United States at the end of January 2021, this year. It was initially detected in South Africa in December 2020. People, they've been talking about this, about South African variant, and they call it beta. And the United Kingdom variant was known as alpha. Okay. And then there is another one, P1, which is called gamma. This variant was first detected in the United States in January 2021. P1 was initially identified in travelers from Brazil. That is what they used to refer to as Brazilian variant, who were tested during the routine screening at an airport in Japan in early January. There is B1617.2, they call it Delta. So Delta is what we have right now. This variant was first detected in the United States in March 2021. This year. It was initially identified in India in December 2020. This is one of the viruses that is killing people in India. And it was first detected here in the United States in March 2021. Now it is this variant that is now becoming more contagious and more infectious, and it is actually killing some of the unvaccinated people. And most of the people who are now hospitalized as we speak are unvaccinated people who have not taken the vaccine. But for those of us who are vaccinated already, I think some of that, you know, this virus could be around with us. But the fact that we have already taken our vaccine could be actually protecting us. Yet, even if we are actually affected, we could still be a carrier of the virus. So that's why the CDC recommend that everybody mask up again so that you don't become a carrier of this virus. That means you can actually make it more contagious to the other people who are not vaccinated. Maybe we are being resistant to it, but at long last, it might actually affect you once again, and you may get hospitalized, and you don't know what might happen. Either you could die or you could survive it. It depends on your immune system. The level of your immune system is not the same. It may be vary from individual to individual. So if you are an older person, your immune system could be weaker. The same thing to apply to the children as well. Right now, a lot of people who are hospitalized, according to the report I listened to on the news, these are young people. And young people were hesitant. They have this mentality or this mindset of negligent or ignorant that this virus is nothing, that it has nothing to do with them. So this is the issue of being ignorant. Or maybe some people are not taking vaccine because of they still believe in the conspiracy theory. Maybe they believe in some political ideology, like what is being preached by some of the Republican members out there, Republican politicians. Some religious pastors out there are also doing misinformation on the social media. So this is very critical. And this is the reason why some people are actually being hesitant, because they believe in some religious pastors, they believe in some politician, or they have their own beliefs. Maybe they believe in conspiracy theory, So anyway, the choice is still up to individual, whether you want to take a vaccine or not. That means you are actually gambling, like Dr. Akuot put it. It is up to you to weigh it. You want to save your life, or do you want to risk it? Either way. We don't want to attend any funeral tomorrow, and then people are going to say, oh, I wish I would have been vaccinated. Like the way we are listening to some of the patients who are already being hospitalized. Now they're talking, they regret. They are being remorseful, wishing that they would have taken the vaccine. Unfortunately, because of this mentality that you just believe in this conspiracy theory, or you believe in that religious belief, now you face the consequences. So don't believe in those pastors, don't believe in those politicians that are spreading all this misinformation on the social media. At the end of the day, they are not going to be responsible about your life. They will not be responsible about the life of your loved one. So talk to each other as a family, talk to each other as a friend, maybe talk to each other as a community. Encourage each other to go and take a vaccine. This is important for your life. We don't need to attend any funeral, ladies and gentlemen. This is why I personally took the opportunity to invite Dr. Akuot and Dr. Malual so they can come and share with you their medical expertise, their scientific expertise regarding this contagious and infectious virus that is now evolving in among us or amid us. So we are encouraging each and everyone to go out there, take a vaccine, so that you can be safe. So I wish you good luck, and let's all hope everyone take the vaccine. So the Lambda variant out of South America is also emerging. Health experts urge that if people want to get back to normal, a significant portion of the population need to be vaccinated. As long as a chunk of people across the world are unvaccinated, new strain of the virus will continue to develop and cause problems. Number 8, COVID-19 cases are surging in the US, largely due to the highly contagious Delta variant. Check out the map below to see how the CD is tracking COVID-19 transmission level by county. So here there is the recommended maps so that you can be able to study each and every county in the United States. And the reason why they're doing that is because they do this according to the statistic in those particular counties. Maybe if you live in the United States, you could live in those counties. And it would be very important for you to have the statistic so that you can learn something from it. And this is also very important for your information, so that you can use it for your own benefit. So you go check a list, get document any lower share away. You can video call it. Daniel in Jal, you show it already. Any document, Nija Quen Beach, Brother Lem ya in Jalech, she document in here. Yoke is one of the documents which are being broadcast in years. So I can't but then Kajan that Daman because Bandy and Barrel or the year and key yoke to one, yen and the Jol along. We check a late, Pokuja Bay Yoke. Recommendation can ye and wake. Get out there, get your vaccine, be in womb, Carter. Popalacrio, Jario, you lay in a Kennedy Walcott, because I roll. A Walcott be the population be and take it. Yes. Kawaja actually bear and gag, the Yawum, Jalkan knock, kill a barolo. Why, let's take the risk. Let's take the risk, guys. So get out there and get vaccinated. I in which you can lay and because you ten, nearly away to call back jam away family, be around at home. Go quite the goki. Go quite pee. Okay, call. I in which I can lay. Thank you very much.
Sudan ma gogunas nas kutar ma zaman harb adol nas tasiti naw basna min al shaytan wa mashakil dunya ay marad ay sabab arafna bism Allah faya 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 Kabala ibarik Sudan kabala ibarik dunya ya jama lo indak go hajagin wajat halid wajat galid asasat العيون شيل لمون نشوف دكتور خليك زول وطني لو عيان ما تسمي الناس تاني نو غسل يدينك بصابون كل زمن عشان ما تسمم غسل يدينك بصابون كل زمن عشان ما تكون نيان غسل يدينك بصابون جنوبي نو جنوب السودان جنوبي نو جنوب السودان في كبرجة كبرجة في كبرجة قالوا في مرض طلع جديد كورونا فيروس في نص الناس بسمم ناس بقتل ناس بسمم ناس الحماية أحسن من علاج سلام بقى من بعيد ما تمسك دين زول ولا دابن زول ولا دابن زول ولا تقوى دم زول خليك زول وطني لو أيان ما تسمي الناس تاني نو غسل يدينك بصابون كل زمان عشان ما تتسمم غسل يدينك بصابون كل زمان عشان ما تكون نيان غسل يدينك بصابون كل زمان عشان ما تتسمم غسل يدينك بصابون كل زمان عشان ما تكون نيان غسل يدينك بصابون.
It happened, it just came out of nowhere. A bus, he was speeding and he...
Have a good night, ladies and gentlemen. Have a good morning, good afternoon, wherever you may be around the world. Thank you very much. This brings us to the end of our show. And we're looking forward to inviting you once again. Once we find something significant to discuss with our two doctors. So thank you for staying tuned and listen to our program. I'm looking forward to see you another time. Thank you very much. Have a good night in North America. Have a good morning in Africa. Maybe good afternoon for Australia. Shukran.